depending on where you are in the country. This is Josh Stone with Policy Stat. Welcome to the webinar. As most of you are aware, usually there are a few laggers, so we're going to go ahead and just put it on mute for about another minute or two, let those last few people join us, and then we are going to get started. So looking forward to it. Thank you. All right, well, welcome everybody. It's about 2 minutes after, so we will go ahead and get started. For those of you who may have just joined us, this is Josh Stone with Policy Stat. Really looking forward to sharing with you all the essential elements to write a policy on policies and why you need one. So a lot of really great content we're going to go through. We're going to get to that very quickly. And just to start off, make sure my slide deck is moving as I need it to. There we go. So Policy Stat, we're the host for today. I'm really not going to talk about us much at this point, but we're very excited. It's a software to help you manage your documents. The bulk of our time will actually be with our presenter, Nita, who has been in this world for hospitals, health system, healthcare, really helping them organize their information and have processes behind it. Definitely don't want to speak too much of what she's about to say because it's some really good content. But before I hand the reins over to her completely, we're going to launch a poll. So if any of you have used this GoToWebinar product before, we have poll options. And really just to help Nita gauge a little bit of who the audience is and what kind of setup you're in right now. This poll is out there, so if you could go ahead and fill it out. Again, it'll just help her kind of answer some questions that may tend to be more prevalent for certain setups for how are your documents currently managed. So we'll just hold this up for just a moment. All right, if you want to go ahead and close the poll down, Sarah. It looks like we have about 70–75% that have answered. And just to give a quick synopsis, Nita, I know you're listening right now. About 30% are on a shared drive type setup, so about a third or so. We have about 20% that are on an intranet or some sort of homegrown. About a third are using a dedicated PMP software. And then the last 20% or so are either SharePoint or maybe paper. So That was a split 10 and 10 there. The last thing I'll mention before I hand the reins over to Nita is in the GoToWebinar tool, there is a place to ask questions. So if you have questions along the way, by all means, go on there, type them out, submit them. We're going to try and answer a lot of those during the presentation itself. If there's some question we either don't get time for, definitely circle back with you on it. Otherwise, Nita, it is your platform to inform us.
Okay, well, thank you, Josh. And first, I want to thank everyone for being part of this webinar, and also thank PolicyStat for sponsoring this webinar content. So what we're going to talk about today is one of the things that I have found in the last 20 years of my policy and procedure healthcare management process improvement for policies and procedures is the lack of or the ineffectiveness on having a policy on policies. And so, Josh, if you would bring the first slide forward. One of the things that I have found is one of the biggest gaps in having an effective policy and procedure management process in your organization, whether you be a really small clinic or an ambulatory surgery center or a standalone facility or even a multi-facility system. And one of those is, as I said, a policy on policies. And what is it? Well, it's really a document that will outline what your process is for managing your documents. And while we call it policy on policies, which I think sounds really bureaucratic, but is really essential, it also should cover not only how to manage your policies, but any of your documents in healthcare, whether it be policies, procedures, guidelines, protocols, plans, physician order sets. So that's what a policy on policies covers. It is the process that you use in your organization to manage your documents that you require your staff to read, review, and approve. So, Josh, if you go to the next slide. The biggest key is, why do you need it? Well, there are a couple of reasons. In healthcare, number one, we have a lot of turnover. So while you have people who are managing your documents, they may be your policy guru, or they may be your staff managers, or your directors, or your VPs. We have a lot of turnover. They either leave or they change responsibilities. So to have a document resource that provides the information that explains what the process is for your policy and procedure management is extremely important. The other piece is that in healthcare, we all know, we deal with document reviews on a very timely basis. However, usually that is not the only hat that that person wears. And they may have 5 or 6 documents that come due for review, or they need to create a new policy once in a while. And then they may not interact with your policy and procedure management system for months. So the part for the policy on policies is that, say your process changes, and I am a document owner or someone who is managing a policy, and I haven't worked with your process for 6 months and something's changed, I can go to that document and I can see what your new process is. Or just to refresh my memory on who I need to send the document to, or any of the other information I need. So it's really more even important in healthcare because of the way that our healthcare organizations work. Okay, Josh, if you go to the next slide. So what we're going to focus on today is kind of what I call the recipe, or the ingredients for a policy on policies. What needs to be in there, what those particular ingredients will contain. Well, the first thing is a policy statement. Now, a policy statement, as with any of your other policy statements, should be fairly broad. The policy statement should say the way that you handle your documents. So I know that we have a pretty diverse audience right now, from everything from folks using paper manuals all the way up to formal policy and procedure management systems. So the policy statement should say how you manage your policies and procedures. We use an electronic software. We use a paper manual. We use our intranet. So it should be very broad because, as we all know, we don't want to get in trouble with regulatory because they hold us to what we say the policy is. So really, the policy statement should simply state how you manage your policies, and also state that the rest of the procedures in the policy will be how those policies will be managed. The second thing is the definitions of the types of documents that you are including in this particular policy. And as I said, if you are using the same method to manage your policies, to manage your procedures, to manage your guidelines, to manage your protocols, position order sets, you need to give the definitions of those documents. What does my organization define as a policy? What does my organization define as a procedure? What does my organization define as a guideline? So you really need to be sure that in that policy on policies, you are very clear as to the type of document and what your organization defines those documents to be. The second thing is you should define the roles and responsibilities in your organization. So, for instance, if you are using SharePoint or you're using paper manuals or you're using an intranet, who manages those documents? So, for instance, one of the biggest things that we use in healthcare is the owner of the document. Usually the owner of the document is a subject matter expert. But in your organization, it may be an administrative assistant, or you may have a particular line of responsibility for those different roles. So you need to define the roles and responsibilities. Who is responsible for managing the document? Who is responsible for approving the document? Who is responsible, if you do have software, for putting the document into the software? Who is responsible, if you do have software, for actually troubleshooting the software? So you really need to identify in that procedure what the roles and responsibilities are in your particular organization. And after 20 years of working in policy and procedure management, process improvement, every organization is different. So it is very critical that you, if you are not sure what your process is to try to define that in this policy and policies. If you are using intranet or you're using software, you need to be sure to give the information in your policy on policies how to get to that place where your policies are. Many times this is forgotten, and so what happens is your staff may not know actually where to go to get your policies or procedures or where to go to review them. So it's very important that you give them the information, the access information. If it is a paper manual, you need to tell them, go to the paper manual in the nursing office. If it's on your SharePoint, you need to give them the SharePoint site. If you are using software, you need to give them the web address for the software. And that's very important. And that's one of the things that I've seen many times, that your staff, we think that they know that where to go, but they don't. So that's one of the more important pieces to that. Okay, next slide, Josh. So what else do we need to do? Well, one of our biggest challenges is for those staff members who are responsible for changing your current documents or creating new documents. And unfortunately, in healthcare, most of the time, those are very, very busy healthcare professionals who wear many hats, and this is just a small piece of their hat. So one of the things that you will want to put is the necessity of the document. If you have not established a process of necessity, you really need to. So for instance, in your policy on policies, you would need to say, you need to contact your stakeholders, in other words, everyone this particular document would touch, to see if this document is really necessary for a new document. So if I'm creating a new document, I would go to this policy on policies, and I would see that I have to contact everyone that this document would touch as far as my peer functional service people to create this document. Or if I am reviewing this document, which has come due for review, I would want to contact my peers to make sure that the edits that I think aren't necessary would be necessary. And if there is a consensus, no, we don't need to change this document, or yes we do, or no, we don't need to create a new policy, or yes we do, at least I would know as a document owner that I would have to do that. So whatever your process is and whatever that particular workflow would be, you would need to put that in your policy on policies. Title and content. Now, we are all across the board on this in healthcare. Some of us in healthcare use numbering systems. Some of us use specific verbiage for the titles of our documents. And so you would need to put that in your policy on policies. We require a numbering system. We require our titles to be in a certain conventional piece. And you would need to put that in there to explain what those titling conventions would be. The identification of who owns a document. Again, usually in healthcare, the owner of a document should be the subject matter expert for the content of the document. But in some cases, it might be an administrative assistant who simply sends the document to the subject matter expert. So you need to identify in your policy on policies who you expect the document owner to be. And now, when you're using software, it's not quite as hard because there are some controls in software. But if you are using, for instance, a paper manual, or you're using an intranet, or you're using SharePoint, pretty much anybody who wants to enter a new document can upload a document, or they can print out a document, or they can send a document around your organization. So you need to be sure that in your policy on policies that you explain what your control mechanism is and how those people who either review documents or who create documents and what they are. Policy areas, so those are across the board as well, but you need to identify if you do have standard categories. So think of a policy area as a category. And in most healthcare, we have administration, nursing, patient care, critical care, finance. But whatever your policy areas are, you need to place them in your policy on policies. If you have not yet standardized those categories, I would encourage you to do that. It'll make your policy on policy much easier, but it'll also create a much easier way for your staff to be able to categorize documents. But in any case, you need to identify what different types of documents go in what different types of categories in that policy on policies. Because if I'm a new document owner and I have a document and I don't know where to put it, and I'm either in an intranet situation or SharePoint or even a paper manual where I put it, it's very hard for me to know where I should put it. So you should give them the direction to do that. Approval workflows. Approval workflows are probably our hardest piece. Who approves these documents? Now, usually the best practice is the least you can put in an approval workflow, the better, because as we all know in healthcare, the more folks you put in an approval workflow, the longer it's going to take for that document to get through the approval workflow. If you do have standardized approval workflows, so for instance, in administration it goes to the manager, then it goes to a VP, then it goes to the board, then you would need to put an example of those approval workflows in there. If you have not yet standardized on approval workflows, that's another place where probably it would be to your benefit and optimize your system to do that. But you need to tell your document owners or the people who are managing your documents what people need to approve the documents that they own. And this is one of the places I've found that are usually lacking in a policy on policies, and this is one of the places that causes the most confusion. So if I am a new document owner and I'm not sure what my approval workflow is, I might send it to 52 different people because I simply say I don't want to leave anybody out. So if you put somebody in, you put the approval workflows in your policy on policies, it will give them a clear direction as to who to send the documents to. And again, I would encourage you to standardize those. Review dates. Now, we all know that with regulatory, we're pretty much constrained with what regulatory says are review dates. And by that I mean, for instance, for lab, now CAP requires 2 years rather than 1 year. Most of our documents can be reviewed every 3 years. However, if you're a critical access hospital, your documents have to be reviewed every year. So this is a place where you need to be very clear as to what review dates are in your organization. So whenever your documents are due for review, you need to put those review date intervals. All of our documents are due every 3 years. Lab is due every 2 years. If I'm a critical access hospital, I have to have it every year. So that is another thing that will reduce your liability when regulatory walks into your organization. The scope is very important, and this is something that I've seen recently in the past year and a half or so that regulatory agencies have been very critical of, who the documents are actually applicable to. So you need to, in your policy on policies, you need to say what documents are in what applicability or what scope. So for instance, if I am a single facility, that's not so hard. It might be the scope is only the employees in the critical care units, or it is a facility-wide document. If you are in a multi-facility system, you have to be very clear. It is applicable to this facility and that facility. It also has to show that it's not all the hospital employees when in fact clinics are involved. So scope is very important, and this is another piece where your regulatory content is very important, because recently I have seen that scope has been looked at more with your auditors. So you need to identify what documents are applicable to which ones of your facilities. Okay, Josh, next slide. Now, you may laugh when you see these fonts. And one of the things that you do need to put in your policy on policies is what your required fonts are. Hopefully, your staff is not using these fonts, but if they are, and of course they could be if you're using a Word-based application or you're using Microsoft Word, as we all know, everybody can choose whatever font they want, Wingdings, Calibri, or these awful fonts. But you should say what fonts you require so that all of your policies look the same. Next slide, Josh. So if you do not have software that forces those fonts, usually the best font is Calibri. It's very easily read. For your headers, they should be in bold and 11 point. For your body text, they should be 10. So whatever, and that might not be the font that you require, but whatever your font is, you have to be very clear on your policy on policies what font your organization requires for your documents to be in. Otherwise, you're going to have fonts across the board, and every one of your policies will look different. Next slide, Josh. Workflows, again, are extremely important, and I can't stress this enough, because this usually leads to the most confusion I usually see in most organizations. They just simply do not know who to send the document to for approval. So you need to be very clear. It needs to go to the manager and then the VP of my service, and then if it's patient care documents, it needs to go to the medical exec committee, or if it's administrative documents, it needs to go to the board. But you have to be very clear, and a really good policy on policy will outline by policy area. So for instance, administrative documents, patient care documents, lab documents, this is the workflow that we require. And again, this will shorten the time that the documents go through the review process, but it also is the biggest question I usually see in new people who are in your organization who you probably haven't had a lot of time to train, and they don't know, so they send it to everybody in your organization. So again, you should be very clear about what your workflow is. If you can standardize those workflows, that is best practice across all of the organizations in healthcare right now. This is a big piece of what everyone is looking at. But again, you really need to be clear to them who they need to send those documents to for approval. Next slide, Josh. One of the things that, we all know that we love electronics and we love software, and we all think that we can look at a computer screen and know what to do. But as we also all know, in healthcare, a lot of us like to have a paper checklist that we can take, that when I'm creating a new document, these are the things that I need to do. So this, again, I can't impress the importance of this. You need to have a checklist for the people who are editing or creating new documents. The first thing you need to do is go to the stakeholders and find out if this document needs to be created. The second thing is, if they say, okay, you need to go into whatever process you have, whether it's a paper manual and you're creating it in Word, or go into SharePoint, or go into your software, and you need to create a new document and draft. Then you need to send it to these people. If you have a checklist, they don't really have to read this whole policy on policies. If you have a checklist that they can actually either download or print out, when they do whatever they need to do, they can check the little boxes as they do everything, and they will get everything done. So again, I know that a lot of folks think that the technology is the end-all and be-all. But again, we all know in healthcare, there are some of us who really like to have that little paper checklist, and that is very important. And that way, you can make sure, and you can say, complete the checklist, and maybe give it to the P&P committee that will show the P&P committee that that person went through all the steps that they needed to do. Also, that way they don't have to go back into, if you're using electronic software, to figure out what that policy on policy said. So I would encourage you to have these checklists that they can print out, that they can view, and that they can use to figure out what they need to do. Next slide, Josh. Templates are very important. And by template, I mean if you don't already have a standard way that you want your policies to look. In other words, all of our policies are going to have the headers: policy, procedure, scope, guideline, whatever. What you do need to do then is first establish those. So the second thing is, if you don't have them, you need to establish them. But most of us do have a template, what we want all of our documents to look like. So you would need to put that in your policy on policies. Here's our template. This is what we expect all our documents to look like. We expect you to use, this sort of font. Now again, if you're using software that does allow for a template to be already formatted, it's not as important. But if you are one of those SharePoint or those paper manual folks, where people are a software that's using Microsoft Word, they may not go by your template. They may simply create their own little version of whatever they want the document to look like. So you do need to be sure to put a copy of your template and say that any document in your organization needs to follow this template, and we expect that. And that way, when they come to your Policy and Procedure Committee, that it will be in the correct template. It will look the way you want them to be, rather than coming to you with something that looks completely different and you telling them that's not our template, and they go back and have to redo it. So it's very important to have a copy of that in your policy on policies. Okay, next slide, John. regulatory standards can be addressed in a couple of ways in your policy on policies. The main thing is you need to tell your staff members who are managing or creating new documents or editing documents where you want those standards to be placed in the document. Some of you may say, we want a references section that has the standards and the standards number. If you're in a paper manual situation, you would want to say, you know, we want the references to be typed out in the references area. If you are in a software application, you would probably tell them to put it under the references heading, and you would probably want them to hyperlink to the standard. But in any case, whatever your process is, you need to tell them how you want them to include the standards for the Joint Commission or CAP or CLIA or any of your regulatory agencies, where it needs to be in the policy, how you want it to be addressed. So, because a lot of times what will happen is your document owners will forget about that. And they will say, well, you know, I'm creating this document, or I'm reviewing this document, or I'm editing this document, and they forget to put the regulatory standards. So if you do have a process where you require the regulatory standard to be placed in the document, in your policy on policies, you need to tell them where they need to put that reference, whether it be an attachment, whether it be a hyperlink, whether it be simply a typed standard. So that's very important on there. Josh, next slide. And last but not least is your education process. Now, some of you may have a formal education process, so you may have already told your staff members, we have this education process. If a document impacts a lot of people and requires a big behavior change, we probably need to create an e-learning module. Or if it doesn't really require a huge change in behavior, it can be educated through staff meetings. Regardless of what your education process is, you need to put it in your policy on policies. And this is something, again, that I see lacking in a lot of policy on policies. There is no direction as to how education needs to happen, or if it needs to happen. So you need to be very clear. If you don't already have an education process, you need to create one. But you need to be very clear how you want it to be done. Most of us use the document impact education piece. So if the document, as I said, if the document does impact a lot of people and it requires a big behavior change, we're going to do formal education, we're going to have in-service training, we're going to have e-learning module, we're going to have testing. If it doesn't require huge change, we go through staff meetings. So it's very important that you explain what education needs to be done before that policy is published. Now, labs don't have that much problem because CAP requires them to do that. So if any of you are lab folks, you know that and you've already taken care of that. But for us in patient care, and my clinical background was respiratory therapy, sometimes we don't quite know, well, what does it require? So you need to be very clear in your policy on policies what you expect the education process to be. It will happen. You can put it into your approval workflow, and then you will be sure that it happens. Okay, next slide, Josh. And contact info. Unfortunately, sometimes we forget to tell people, if you don't know how to do any of these things, or you have questions about any of these things, then who do you contact? So in your policy on policies, you need to put whoever your policy guru or administrator is for, policy questions. But if you have software, you also need to give the information about how to contact your help desk, how to contact the vendor support, and you need to tell them where to go. So if I'm a new document owner and I've just read through this great policy on policies and I still have a question, where do I go? So you need to be sure to give them the information of who to contact in your organization if they have questions either on process or on technical situations where you have software. Okay, Josh, next slide. Okay, so let's open it up for questions. Josh, I know you've got the chat open. Do we have any questions?
I think we'll go ahead and just pause for just a moment and make sure that if anybody had any, then we'll just let them type in right now. I know sometimes when I'm watching these, I'm paying attention. I have questions, but I don't type them out right away. So I think we'll just wait maybe 30, 60 seconds, and then we'll jump into those. Nita, are you there?
I'm here.
So you can still hear me. Great. So one of the questions was, an implementation process, what does it take for writing a policy on policies? So I know you just mentioned towards the end there about change of behavior, change of scope. Is it mentioned in staff meetings? Is it e-learning? Where does that fall? So maybe you can comment a little bit on, we've worked on a policy on policies. How do we implement it? What steps maybe should be considered to make sure everybody's aware of it?
You're talking about a policy on policies or an education on a specific policy?
No, like the policy on policy. So maybe our hospital didn't have it before, and we do now. How do I make sure, what's the best way to go about getting everyone on the same page with following the policy on policy?
Okay, that's a great question. Actually, the policy on policies kind of can fall into the same thing as an education on an individual policy. If you have a policy on policies, the first thing you would need to do is to identify your staff who are responsible for either reviewing and editing current policies or creating new ones. And then at that point, what you would want to do is, there are two options. If you do have an e-learning system, you could probably do a module on that. What I found the best thing to do is simply do a short webinar. And most of you do have, access to some sort of webinar, software. But to explain what the policy on policies is, and then you would require anyone who is responsible for reviewing, editing any of your documents to attend that, and then record it, because we all know that we're busy healthcare professionals and we don't often have time to go to one webinar or whatever. But to require that anyone who is managing your policies, either reviewing or editing, would have to go to an education session on that policy on policies, so that they understand, and then you go through your policy on policies and say, this is what you're required to do, this is what my organization requires you to do, and you need to understand that all of your documents have to come into this policy on policies. So again, the best thing to do is to get them all together if you can on a webinar, but also to record it. But most of the customers that I work with, when they do, if they have not had a policy on policies and they are introducing it for the first time, they require anyone who is responsible for being the owner or manager of those documents, those policy documents, to attend that education session. So I found that usually the best way to do it is through, GoToMeeting or Link or whatever your organization uses for online sessions. Because again, if you're in a small facility, you can get everybody together in a room and show the policy on policies and explain it. If you're in a larger, more diverse system, you would need to set up some sort of GoToWebinar. But you do need to go through it with them, and you need them to look at that policy on policies before you allow them to continue to edit documents.
Great. One other question, and maybe we'll answer the others offline. The question, I'm going to kind of reword it my own wording. What are the sneaky mistakes that people might make with regards to implementing one of these? So as you've worked with a lot of organizations, it sounds like this is a good idea, but darn it, when you walk down the line with this, it causes problems. So anything that jumps out at you is those kind of sneaky mistakes that the people can avoid.
Okay, and I like that. I really like that, sneaky mistakes. The first thing is you need to get leadership acceptance of the policy on policies. So if you do not have that before you start to try to implement a policy on policies, you're not going to get buy-in. So I've found that the organizations that create a policy on policies have the buy-in from the people in your organization that will say, this is what we expect. One of the sneakiest mistakes I've ever seen was, just somebody who was working with policies and they decided to create a policy on policies on their own, and they established it, they did not communicate it, they did not pass it by leadership, and then they started calling out folks that didn't follow the policy on policies. And we all know that happens. It's healthcare. We all know that. So I think some of the sneakiest ways that you can do that is to keep it in the background. So I think that the biggest thing that you can do is to get your executive leadership. And I don't care how small you are or how big you are. There are some people that are definitely in leadership positions that need to say, this is what we are going to follow. And if you don't do that and you try to just do it on your own and you're not at that level and you don't have the political clout, I hate to say that, to actually enforce this document, people will go around it. So the biggest thing I can say is get somebody in an executive leadership position to back you on creating a policy on policies and to actually tell your organization this is what we expect. It may be a PNP committee meeting. It may not be a leadership person. But that's one of the sneakiest things I've seen is that somebody tries to create it and then somebody tries to go around it, and without leadership, you can't really enforce it.
Great. Well, I think we'll wrap up the Q&A. Like I said, some of the other questions that were asked I think will be better to answer offline. So let's do maybe a brief summary, and then we'll get towards wrapping this up.
Okay. For a summary, like I said, there are several main things you need to put in your policy on policies. First thing is have your policy statement, who does what in your policy management, so your roles and responsibilities, definitions of documents, why the document's necessary, what your approval workflows are, who owns documents, what the scope of the documents are. Tell them what the required fonts are and what your workflows are. Give them checklists. Give them something that they have to actually check off before they can get a policy, a new or revised policy, through your Policy and Procedures Committee. Tell them where your regulatory standards need to be referenced in your documents. Tell them who and what and when your staff need to be educated on the document, and tell them who to call in your organization. Okay, Josh.
Great. Well, we're going to transition, and we have one last poll that we're going to ask, and while Sarah here is helping me, goes ahead and launches this. Really, the question is, have you ever viewed a dedicated team peer software before? If you're expecting me to go through a demo today, I'm sorry, I'm actually not going to. I'm just going to touch on a few items within the PolicyStat tool because a lot of folks, frankly, a lot of folks don't know this type of tool exists, or they haven't heard this kind of presentation of being able to structure policy on policy and what that would actually look like in software. So again, we'll just keep this poll open for just a moment. And I'm just going to walk through a high level, connecting some dots of what Nita talked about and what it looks like in the PolicyStat tool. So I think we got an okay % that have filled it out. We'll go ahead and and shut that off. Looks like it's about 50-50 as to whether folks have reviewed this type of tool or not. So again, I'm going to really do a crash course. One thing I'll mention is in the questions area of GoToWebinar, if any of you wanted to explicitly set up a time to review PolicyStat with us, just make a comment in there, state it as a question, I want to review PolicyStat, can you contact me? Something along those lines, and we'll have those reports to see it. But the couple pieces I'm going to touch on tie back to what Nita was mentioning. The very front of her presentation mentioned a place where staff can get to the information, be it a policy on policies or your protocols, guidelines, procedures. A dedicated software will provide that. So if anybody's looking for a piece of information, they will be able to get to that piece of information as appropriate. Also, they're only able to get to the most current version of it, so you don't have to worry about, oh, they stumbled upon an archive or we forgot to post it. Additionally, I'm going to actually go into a logged-in view of PolicyStat with a lot of the topics Nita talked about. Really, the question as you kept going through this, Nita, that was boiling through my head was, if I'm a healthcare provider, I'm a manager, I'm a chief nursing officer, I'm a leadership role, what do I want to care about? What do I need to be double-checking? Or what is already being done for me? So you got to wear a lot of hats. What hats do you want to take off? And for some of them, in a dedicated software, those hats you can take off. You don't have to worry about them. You talked about templates. A good software is going to have templates in here so everybody is starting from the same framework. There was mention about checklists. Definitely, I am somebody that also appreciates the handwritten, I can scribble it off and mark it off checklist. But a lot of the items on those checklists would be dedicated and kind of auto-built into a software. You have to put a title. You have these document properties where you clearly identify who is the owner of this document, which category, department, type is it in, what approval workflow does it have to go through. So you clearly identify who has to process this document, and as you all know, you'll have different processes for different types of organizations with different types of departments. Further, as you keep going down in these properties, when's the next review date? You are required to put these in here. There has to be a next review date. You can also set defaults. So she mentions the cap regs of being 2 years. Well, the default here would be 730 days. So again, my point is not to be a holistic demonstration of what PolicyStat is. Really help tie it into what Nita's saying, that in a dedicated system like this, as opposed to a SharePoint, as opposed to a Word-based environment, I'm being reinforced with what all these are. One added benefit of the PolicyStat platform in particular is because it's a web-based platform, when she's talking about fonts, those are enforced system-wide. Your end user doesn't even have to worry about picking the wrong font. Conceptually, it's a lot like CNN.com. Whenever you go on CNN and you look at a news article, every news article is the same font. They don't have to rely on every one of their authors to do it. They have a system in place that dictates that and reinforces it. So it's the same principles here. Additionally, and this will be the last thing I comment on, that approved workflow piece you mentioned can get really cumbersome to know who and where and what. Again, a good dedicated tool will have a lot of these reports built in, so if you're curious what documents you have, you'd be able to see what is it, who are we waiting on, and how long have we been waiting on somebody. So again, this should help reinforce a lot of those policies on policies. The idea with our structure is the minutes you're spending related to policy management are minutes spent on the content, minutes spent on what it should say, rather than spending as many minutes on, did we have this piece of information, was this tracked, was that tracked, where does this stand? Again, wear a lot of hats, we want to try and take some of them off. Again, we really appreciate everybody's time today. That's where I'll go ahead and wrap up. Like I said, if you were wanting to get in touch with us, you can just do it in the chat box. Obviously, we have a website. You could also contact us there. Otherwise, we really appreciate everybody's time. We hope this was beneficial for you. We will have a recording of it that we'll make available as well. So again, enjoy your afternoon, and thanks so much for joining us with PolicyStat and how to write a good policy on policies. Thank you.